Well, if you've ever felt a tingling in your thumbs and chronic pain in your wrist and arm, then you know very well what it's like to have carpal tunnel syndrome. When it's not treated properly, the symptoms will only get worse. So for a better understanding of what's happening and why, we turn to orthopedic surgeon Dr. Millard with OrthoNeuro. Thanks for joining us.
Thank you.
Okay, doctor, so your specialty is hand and elbow. So can you explain in basic terms exactly what carpal tunnel syndrome is?
Well, carpal tunnel basically is just compression of a nerve at your wrist. It's called the median nerve, and it just gets compressed right as it goes across the wrist in an area called the carpal tunnel.
Okay. What are the first signs? If someone's out there wondering what's happening, what are those signs?
Generally, the first thing that starts bothering people is they'll wake up with their hands numb in the morning. Usually it's the thumb, index, and middle finger. They'll start waking up, they'll say their hands numb in the morning. Then when it progresses, it actually starts bothering when they're driving. A lot of times people's hands go to sleep at work when they're using them. Probably one of the biggest complaints, though, is people coming in and saying they actually cannot sleep through the night because they keep waking up with their hands numb.
Oh, it's definitely a little scary when that happens too. And I always thought the biggest cause of this was, our constant use of keyboards and our mobile devices, handheld devices, but you say there are many other causes, right?
Yes, there are multiple causes for it. Of course, the things that you mentioned are some of the bigger causes. Keyboarding a lot of times, repetitive use, particularly people that work in factory assembly lines that are doing the same activities all the time. But basically, it's anything that causes swelling in the carpal tunnel around your wrist. And the carpal tunnel is a very small area that has a number of tendons going through it along with the nerve. So if you're doing something repetitive or you injure that area that causes swelling, the softest structure in that area is the nerve, and it gets compressed.
So once you've diagnosed the problem, what's the next step?
Well, diagnosing it, usually we will do basically a physical exam. There are a couple positive signs that we'll find on that. Most of the time we'll do an EMG or nerve conduction velocity study. They're not particularly comfortable studies to go through, but it gives us a good idea of the status of the nerve. Then depending on that, if it's not too bad, we'll usually start off just having people wear a splint at night. One of the problems when people sleep is they tend to curl up their wrists and sleep in a position like this. That puts a lot of pressure on the nerve. So what we try to do is put people in a splint that keeps their wrist straight, tries to rest the nerve. There are also a couple exercises we have people do that are called nerve gliding exercises. And if it's something that's really bothering somebody at work, we'll look at their workstation, how they work, see if they're doing the same thing all the time that's causing irritation of the nerve, and try to modify that.
Sure. And when it comes to treatment, is it about managing the pain, or can you actually reverse the physical problem?
You can reverse the physical problem. A lot of times the first thing, if the therapy and the splints don't work, we'll try steroid injections into the area, see if we can just decrease some of the swelling around the nerve. And if that's not successful, then we do surgery to release the pressure on the nerve. Releasing the pressure on the nerve does reverse the effects right away.
What is the timeline of a recovery from a surgery like that?
Well, depending on how it's done, I do it endoscopically, which means just a small incision across your wrist, release the pressure on the nerve. Usually, once you've done that surgery, when I see people for follow-up, their first comment is that the night after surgery was the first full night of sleep they've had in years. Afterwards, people are usually just an ACE wrap around their wrist for about 5 days. After that, I have them put a Band-Aid on and keep using their hand like normal.
Oh, so is there any therapy involved after that?
They'll get one therapy visit just to go over some exercises with them again, teach them how to manage the scar, but for the most part, nope.
What happens if carpal tunnel goes untreated, doctor?
If carpal tunnel goes untreated, people start having worsening symptoms. One of the big things that people come in complaining about is clumsiness. They have a hard time feeling things, doing buttons on sweaters or shirts. They have a real hard time using their hand, and then some of the muscles actually start atrophying in your hand. And once you get to that stage, it's very hard to reverse it.
And how can we avoid developing carpal tunnel? Is there a way?
Unfortunately, the only ways really to prevent it are some of the nerve gliding exercises that I mentioned and adjusting your work environment. In other words, taking a break if you're on a keyboard all the time, taking a break, doing some stretching, adjusting the ergonomics around your workplace.
Okay, so to get started, that initial consultation is a great first step, correct?
Correct, yes.
Come and see you, ask any questions.
Absolutely.
Reach out to the OrthoNeuro team, Dr. Millard, at orthoneuro.com. Information is on your screen. Thanks so much for joining us,
Thank
Doctor.
you. Thanks.